Chapter 14, Introducing In-Depth Interviews. Savita Rabindranath Mehta Joshi. Abstract. The interview is one of the commonest qualitative data collection methods used in healthcare research. Interviews are considered when the interviewer wishes to explore the interviewee's feelings and perspectives on a research topic. In-depth interviews are useful when one wishes to ask open-ended questions to obtain a depth of information from a relatively small number of respondents. Interviews generate rich information that can be used to understand a problem or issue in detail. They are used for a variety of purposes, including needs assessment and to identify gaps in a program or situation. It involves one-on-one engagement with the participant, usually done face-to-face or occasionally over the telephone. An in-depth interview duration usually ranges between 60 minutes to 120 minutes depending on the subject matter and the context. An interview could be structured, semi-structured, or of unstructured format. There are 4 steps involved in conducting in-depth interviews: developing a sampling strategy, writing an in-depth interview guide, conducting the interviews, analyzing the data. Interviews require a highly skilled interviewer to conduct an interview, one with considerable knowledge and experience. In-depth interviews are usually audio recorded or written down as notes verbatim. The transcribed data is coded, analyzed, and findings are reported. The process of data analysis and reporting is similar to other qualitative data analysis and reporting process. Software are available to help in the process of analysis. In-depth interviews have both advantages and limitations. Data obtained cannot be generalized to the population. It can be combined with other research methods. Keywords: qualitative research, in-depth interview, semi-structured interviews, unstructured interviews, education, health science. Assess need. Interviewing is a paradox. From a distance, it appears deceptively simple. In-depth interview method is used to delve deep into the human experiences, views, and perceptions on one or two issues to understand human behavior. The rationale for using interviews in healthcare practice is to produce empirical data or evidence that can help healthcare professionals develop better healthcare practices. Use of IDI helps the researcher and clinician to understand the views, opinions, and practices of the patients and caregivers on healthcare issues. This qualitative input can help develop a comprehensive clinical care pathway that is holistic in approach. In medical education research, IDI can be used to understand student views, perceptions, and experiences of a newly introduced curriculum, to identify the strengths and gaps as perceived by the students, enabling the faculty to bring in change in delivery if needed. In this chapter, we have used the terms interviews and in-depth interviews interchangeably. Brief. In this method, one or two issues are discussed in detail. The purpose of IDIs is to collect a rich individual experience that helps in understanding the perception of the interviewee on the research topic. Interviews are usually conducted with small number of respondents. Experienced interviewer with active listening skills will be able to capture the underlying beliefs, attitudes, and feelings of respondents on a particular subject. CO and 3XTUA rise in E. It was observed that the stress levels in the nursing staff posted in covered wards in a private hospital, where the first author works, were very high. The head of the psychiatry department decided to conduct IDIs with few of the nurses who were posted in COVID wards during both COVID waves. 12 nurses were interviewed to understand their thoughts, perceptions, and beliefs with the intention to address the issue of coping with distress. All the interviews were conducted by a single researcher. The outcome of these interviews was development of coping strategies by the Department of Psychiatry. All the nurses who were posted for COVID ward duty during the pandemic were then trained to handle the stress using short experiential modules. Have you conducted an IDI any time? For what purpose did you use this qualitative data gathering technique? Did you face any difficulties while conducting the interviews? Describe what is an in-depth interview method. IDI is a data gathering technique intended to present interviewees' standpoint or perspective on the research topic. We need to differentiate a research interview from that of a journalistic interview. In the latter, the respondent often controls the presentation of information, while the interviewer has his own agenda to get what they can get out of it. Interviews are generally conducted with small number of participants on one-to-one basis. It is not a question and answer session. Rather, the interviewee is considered as being knowledgeable on the topic, and the interviewer a novice trying to learn from the interviewee. Thus, the interviewee contributes to making a meaning instead of responding to the views and perceptions of the researcher as happens in structured surveys or questionnaires. IDIs are conducted using mostly open-ended questions in conversational style, many of times followed by why and how to get deeper understanding of the interviewee's perception. When are in-depth interviews appropriate in educational research? IDIs are very commonly used for program evaluation input process. It offers an opportunity to gain insight into how individuals interpret a particular issue. IDIs are commonly conducted to understand the perceptions of patients, caregivers, or healthcare providers on diverse research questions such as how is pain perceived by patients in palliative care. Why do general practitioners prescribe antibiotics for common cold or flu? Why do students miss out on assignment dates? This method of data gathering could be used alone when you want to get individual members' thoughts with open-ended questioning, are not sure of getting honest answers from participants during a focus group discussion, are seeking information on sensitive personal issues, seek inputs from various key stakeholders on one-to-one basis while conducting program evaluation. Or IDIs could be useful in mixed method research either to add depth or to supplement other research approaches. For example, IDIs could be conducted prior to developing a survey or finalizing on FGD questions. Post-survey when some close-ended questions generate unexpected results. If, after drafting a survey questionnaire, you realize that important questions cannot be effectively addressed without more open-ended questions and extended probing. What are the types of in-depth interviews? Interviews have been loosely classified as unstructured, semi-structured, or structured interviews. Structured interviews generate quantitative data, whereas semi-structured and unstructured interviews are suitable in generating qualitative data and will be the focus of discussion in this chapter. Though called unstructured, no interview could be totally devoid of any structure. The major difference among these different interview types is their degree of rigidity with regard to presentational structure. Table 1 shows salient differences between these three types of interviews. Type of interview, format, structured interviews, completely structured, strict adherence to question order similar to a survey questionnaire. Semi-structured interviews, somewhat structured, interviewer can change the order of questions. Unstructured interviews, completely free of any structure, interviewer has full freedom to ask any questions in any order. Questions format. Questions to be asked exactly as written in the guide, no change of words allowed. Words of the questions flexible and may be altered to make the interviewee understand the question. No set wording to any question. Process of interview. No additional clarification questions allowed. Interviewer may respond to questions from interviewee and clarify the doubts. Interviewer may answer questions and give clarifications during the interview. Process of interview. No additional questions may be added during the interview. Interviewer may add or delete probes during subsequent interviews. Interviewer may add or delete questions during interviews. Type of data. Generates mostly quantitative data. Generates narrative, qualitative data. Generates descriptive, qualitative data. Analysis of data. Easy to analyze and possible to generalize. Tedious data analysis process, results not generalizable. Tedious data analysis process, results not generalizable. Structured interviews. In this type of interviews, the interviewer has a set of structured questions for which he is looking for answers in terms of thoughts, opinions, and attitudes from the interviewees about study-related issues. The interviewer cannot change the order or the wording of the questions, nor can he is asked any probing questions. He has to strictly follow the scripted questions in the guide. The rationale here is to offer each interviewee almost the same stimulus so that responses to questions ideally will be comparable. The researchers have a fairly good idea about the information that is expected to emerge from these interviews. Semi-structured interview. This type of interview is commonly the singular data source for the qualitative research question. The semi-structured interview is a pre-planned event with time and venue decided in advance in contrast to unstructured interviews, which happen anywhere and anytime as the interviewer is observing the interviewee in the field. These semi-structured IDIs are based on a few open-ended questions, which may be expanded, modified, or further probed based on the interviewee's responses. The duration of the interview varies anywhere between 30 minutes to several hours and are most often conducted once with one interviewee. IDIs with an individual allows the interviewer to delve deep into personal and social matters. It enables interviewees to speak in their own voice and express their own thoughts and feelings. The questions for IDIs needs to be adequately focused such that a relatively identical group would have shared the experiences about the topic. Based on the main research question, which may be a good question to start the interview, anywhere between 5 and 10 more specific questions are usually developed to explore more deeply into different aspects of the research topic. These questions may be modified or even deleted and new questions added depending on the responses obtained and also on the results seen as the data is simultaneously analyzed as it is collected. The iterative process, which is a typical feature of qualitative research. The interview guide helps in keeping the discussion in the right direction. Unstructured interviews can also be called as guided conversations. This technique is more commonly used by anthropologists for ethnography research during the process of participant observation and taking field notes. The researcher identifies a few key informants based on their knowledge and role in the research settings, and their ability and willingness to contribute as a mentor or a commentator for the researcher. Unstructured interviews are generally conducted along with observations and field notes as a method to add meaning to the observed behavior. Interviewers begin with the assumption that they do not know in advance what all the necessary questions are. Hence, it is not possible to prepare a complete list of questions to ask. Here, the interviewee determines the flow of the topic rather than the interviewer. What are the steps involved in conducting an IDI? Step 1. Develop an interview guide. The purpose of drafting the questions and an interview guide is to ensure that all the topics for which inputs from the interviewee are sought are covered during the interview. This guide is essential when a number of interviews are conducted, especially when conducted by different research team members. The questions should be flexible and serve as a trigger for the interviewee to delve deep in the research topic. Sufficient time should be spent in writing, refining, and protesting the questions and the guide. It is advisable to prioritize the questions and mark them as critical. Others can be categorized as optional or secondary and can be asked if time permits. Always consider the interview guide as work in progress, and depending on the feedback received in the field, adjustments in the questions will have to be considered. Box 1. Tips for drafting interview questions. Questions should be open-ended. Example, instead of asking, do you know about the curricular changes? Ask, please describe what you know about the curricular changes. Start with simple direct question. before moving on to perception opinion questions. For example, ask what events were conducted as a part of this change. Before asking what did you think of the events, use probes as and when required. Some questions that could be used as probes include: would you explain this further? Can you give an example? Would you explain that a bit? I'm not sure I understand what you're saying. Is there anything else that you would like to add? Step 2. Identify and select interviewees. Once the target group or groups have been identified based on the research question, interviewees can be selected by random or stratified random sampling if the group is large. If the target group is small, and if time and resources are not limiting factors, then all members could be interviewed. As mentioned earlier, in-depth interviews are conducted to know the shared perception or feelings of a fairly homogeneous group. So, the interviewees should be selected from a similar cohort with respect to the research topic. Generally, a purposeful sampling method is followed to optimize the richness and depth of the data obtained. Based on the iterative data analysis, if gaps are found in the responses obtained, additional interviewees may be included at a later stage. Once the interviewees are selected, they need to be informed about the purpose of the interview, a brief introduction about the research project, and approximate time that will be needed. This information can be shared either through a telephonic call or by mail. At this stage, it would be a good idea to mention about the voluntary nature of participation, confidentiality, and anonymity issues. Step 3. Develop a rapport with the interviewee. Developing a rapport with the interviewee is a fundamental requirement. Unlike unstructured interviews of ethnography research, where the interviews are conducted over a few days, thus giving ample time for the interviewer to gain the trust and develop rapport with the interviewee. In IDI, the rapport has to be developed quickly. Having a relaxed and safe environment helps in the process. 4 stages of rapport building have been described by Spradley and others. These include apprehension, exploration, cooperation, and participation. These steps have to be kept in mind while building a rapport with the interviewee. Step 4. The interview process. After the initial welcome and formal introduction, interview is started with few general, even a closed-ended question which can be then further probed with why do you feel so? Or can you explain why? Once the interviewee moves from apprehension to exploration stage of developing rapport, you could start asking direct critical questions. As the agenda for the interview is always flexible, if the dialogue moves from question 1 to question 3, let it go in that direction. You can always come back to the questions that were missed out. The potentially uncomfortable, controversial, or awkward questions should come toward the end. By this time, the interviewee would have reached the final stage of rapport, the participation where sharing of such information comes without hesitation. General demographic information can be filled in a standard form provided to the interviewee before or after the interview. With the consent of the interviewee, the interview can be recorded using a digital audio recorder. This will allow the interviewer to actively listen to the interviewee instead of trying to take complete notes. Interviewer may note down certain expressions or hesitancy shown while answering sensitive questions. On completion of the session, review the interview guide to check that no key questions were missed out. The interview can then be concluded with a cordial greeting for having spent their valuable time and shared their personal views and perceptions with you. It is a good practice to complete the interview notes by the end of the day so that the same can be shared with other members of the research team. Raw notes should be edited, reviewed, and entered in a computer file while it is fresh in the mind. What are the ethical issues to be considered in conducting IDIs? Following 4 ethical issues may be considered while conducting IDIs. 1. Risk of unanticipated harm to the interviewee when the interviewer listens actively and repeats the information back to the interviewee. Sometimes this may trigger unexpected reaction from the interviewee leading to unintended harm. For example, while talking about their life experiences, some respondents may feel unexpected intense feelings ending in grief. Hence, remember, as an interviewer, you may have to provide psychological support if the interviews create undue stress or cause psychological complications. Maintaining the interviewee's information confidential. It is very important to maintain anonymity of the interviewee's information shared with you during the interview. Many a times, interviews may lead to venting out frustrations towards higher ups in the organization. If this information leaks out, it may put the position of the interviewee in jeopardy. Hence, maintaining anonymity of the interviewee while reporting is most critical. 3. Informing the interviewee about the nature of the research accurately. This is sometimes an issue when the investigator may not initially know what the preliminary interviews may reveal. The interviewee should be informed beforehand about this and given a choice to withdraw from the study at a time. 4. Chances of exploitation. Personal gain should not be a motive for conducting interviews. The contribution made by interviewees to the success of the research should be acknowledged and their efforts should be compensated in various ways. How are in-depth interviews analyzed? Ideally, qualitative data analysis occurs parallel with data collection. This will help the investigators to advance their understanding of the research question, which in turn will influence the sampling size and further modification of the interview questions and the guide. This reiterative process of data collection and data analysis, which is a characteristic of qualitative research analysis, eventually reaches a stage where no new categories or themes emerge. This is called the saturation of the data and is a sign that data collection is complete. The first step in analysis of in-depth interview is to transcribe the data collected either from the audio recording or the handwritten notes. It is important to take into account nonverbal communication as well like body language, gestures, tone of speech while transcribing the audio tapes. Computer-assisted qualitative data analysis software such as Atlas TI, Folio Views, and NVivo is now available for data coding and theme generations. Box 2 Steps for analyzing data of in-depth interview. Read a few times the transcribed notes. Observe if there are any common threads or themes emerging in the notes. Note down the themes as you read through. Group the responses of each participant under a theme if similar. While analyzing, observe for any emerging new information based on demographic data. Like, does gender make a difference in beliefs, experiences? Could that be grouped? Observe and note body language, eagerness to share information against monosyllabic response. How are in-depth interviews presented in a paper? When presenting the results of interview analysis, the format is a descriptive writing. The findings can be presented under the themes or narratives that emerged in analysis. These are then written down as a descriptive expression of the experiences narrated by the interviewee. An in-depth description of participant perspectives is shared. In interview research, the participants' words are your data. What are the potential advantages and disadvantages of IDIs? Table 2 Advantages and disadvantages of interviews. Advantages: sharing the perceptions. Opinions may serve as a release for the interviewee. Disadvantages: time consuming with regard to both data collection and data analysis. Possible to get answers to all questions, usually done on a small scale. Possible to get clarifications for both interviewee and interviewer. Not possible to maintain 100% anonymity. Comparatively less expensive, less manpower required. Potential for possible bias. Interviews grant a sense of empowerment and self-awareness to the interviewee. Interviewees will only give what they are willing to reveal about their perceptions and opinions. Gives voice to the unrepresented and marginalized people. These perceptions, being subjective, might change over time and situations. Summary: the interview is one of the commonest qualitative data collection methods used in healthcare research. It is a data gathering technique intended to present interviewees' standpoint on the research topic. IDIs are useful when one wishes to ask open-ended questions to obtain a wealth of information from a relatively small number of respondents. Interviews are classified broadly into three types: structured, semi-structured, and unstructured. Structured interviews generate quantitative data, while semi-structured and unstructured are formats used in in-depth interviews to obtain qualitative data. The steps involved in conducting in-depth interview consists of 4 steps. Develop an interview guide. Identify and select interviewees. Establish a rapport with the interviewee. Finally, the interview process. A skilled interviewer will actively listen to what is being said without interruption to hear what the participant is saying. They may occasionally prompt or request the participant to expand on an experience or belief, noting at the same time expressions, body language, tone of voice, and gestures. All these together enables the interviewer a deeper understanding of rich qualitative data. The process could be preferably audio recorded to enable the interviewer to concentrate on the active listening, with occasional noting down any specific expressions or body language that may contribute to the richness of the information. The data is then transcribed. These notes can be categorized into themes that will have rich data under each area. Computer-assisted software can also be used for data analysis. The presentation of this is usually in a descriptive format. The narration is usually done under themes. The observations of tone, body language noted during the interview are also described to enable a clear capture of qualitative information. Evaluate. India has 8.6% of the population in geriatric category as per census 2011, with the numbers increasing at 3% per year. Of this, 71% reside in rural India and 29% in urban settings. An initiative was undertaken to understand the health issues faced by the elderly in rural areas where access to health care is limited. A team of 5 research assistants was set up to meet the elderly citizens in the Chintamani Taluka in Karnataka, with 30 villages under it as a pilot study to understand their needs and issues faced by them. 5 senior citizens from each village were selected to participate. The outcome of the interactions would enable the researcher to give feedback to the healthcare service provider of the strengths and gaps in delivery of healthcare. Question: please identify the stakeholder groups that could be included. How many stakeholder groups could you identify? 1. What is the ideal method that could be used to gather stakeholder opinions? 2. What are the ethical issues involved? 3. If you would like to use in-depth interview method, what are steps in preparation? 4. If you are the interviewer, list the questions that you would like used to obtain perceptions, views, and beliefs of the interviewee. Road ahead. Though face-to-face interviews are traditionally considered ideal, many times geographical distances and selecting a suitable time may force the interviewer to look for other possible alternatives. These could be telephonic interviews, computer-assisted interviewing, which could be either done synchronously using various e-platforms such as Zoom, MS Teams, Google Meet, or asynchronous such as through emails or social media such as WhatsApp. COVID-19 pandemic has introduced us to many electronic virtual media that could be conveniently used to conduct interviews from the comfort of one's home. Table 3 briefly describes advantages and disadvantages of some of these unconventional modes of conducting interviews. Criteria: time, telephonic interviews, synchronous communication, virtual media, synchronous communication, email, WhatsApp, Messenger, synchronous or asynchronous communication, place, asynchronous communication, asynchronous communication, asynchronous communication, accessibility of the interviewee, wide geographical access, People from all over the globe can be interviewed. Wide geographical access. People from all over the globe can be interviewed. Wide geographical access. People from all over the globe can be interviewed. Type of population. Possible to get hard to reach populations such as duty doctors, nursing mothers, people with special needs. Should have access to the virtual platforms. Should be able to express fluently access to smartphones or computers. Social clues. Body language, appearance clues lost, but voice and intonation are still available. With video on, social clues can be easily captured. No social clues can be picked up. Response time. Interviewee can directly react to the question, leading to more spontaneous responses. Interviewee can directly react to the question, leading to more spontaneous responses. Interviewee can reflect on the questions asked and respond after deliberation. Data collection. Interview can be recorded and then transcribed. Both recording and transcription of the interview is possible. Direct transcription is available, saving on time.